Hello and welcome. Today we're going to talk about something really important for our cat companions, the single most common heart disease they can get. It's called Hypertrophic Cardiomyopathy, or HCM for short. Now, whether you're a cat owner who just wants the best for your pet, or maybe you're just starting out in your veterinary studies, my goal here is to make this condition easy to understand.
So let me ask you a question that might sound a little strange. Could your cat, who looks perfectly happy and healthy, actually have a hidden heart condition? It's a surprising thought, right? But the thing about HCM is that it's sneaky. It's often a silent disease. In fact, some studies suggest that as many as 1 in 7 cats could be affected, and a huge number of them show absolutely no signs in the early stages. So what is feline HCM, really? That name, hypertrophic cardiomyopathy, is a real mouthful, I know. But if we break it down, it's actually pretty straightforward. Let's take a look at what's happening inside a cat's heart when they have this condition. Okay, to understand HCM, you really have to focus on one part of the heart, the left ventricle. You can think of it as the heart's main engine. Its job is to pump that oxygen-rich blood out to the rest of the body. In a cat with HCM, the muscular walls of this chamber get too thick. They hypertrophy. And this isn't like building muscle at the gym. This is a bad thing. It makes the heart stiff and way less efficient at its job. Here's a great way to picture what's happening. Imagine the left ventricle is a room. In a normal, healthy heart, the walls of that room are just the right thickness, leaving plenty of space inside for blood to fill it up. But with HCM, those walls thicken inward, which shrinks the size of the room. So not only does less blood fit in, but those thick, stiff walls make it really hard for the chamber to relax and fill up between beats. In vet terms, we call this diastolic dysfunction, and it's really the core of the problem with HCM. So now that we have a feel for what HCM is, the next question is pretty obvious, right? Which cats are the ones who are most likely to get it? And while it's true that any cat can be affected, there are definitely some risk factors we know about. The most important thing to know is that HCM is, first and foremost, a genetic disease. It's inherited. Now, sure, other things like high blood pressure or an overactive thyroid can cause the heart to thicken, but true HCM comes from their genes. We usually see it show up in middle-aged cats, say around 6 years old. And there's some evidence that male cats might be affected a bit more often. And because genetics are such a huge part of the story, we've even found specific gene mutations in breeds like the Maine Coon and the Ragdoll. Other breeds like Persians and Sphinx cats also seem to be at a higher risk. But, and this is so important to hear, this is not just a problem for purebred cats. We diagnose HCM all the time in our regular domestic shorthair cats, our wonderful mixed breed kitties. All right, this brings us to what I think is one of the most vital parts of this whole explainer. What can you actually look for at home? Because HCM is so often silent. Being an observant partner in your cat's health is it's everything. This quote from the veterinary world really just says it all, doesn't it? The fact is, many, if not most, cats with HCM are found by accident. It's during a routine checkup when a vet listens to their chest and hears something that's not quite right, like a murmur or a gallop sound. The cat often seems totally fine at home until the disease is pretty far along. So what are you watching for? Well, the early signs can be super subtle. Maybe your cat just gets tired a little faster during playtime. But as things get more serious, you might see signs of heart failure, like breathing that's too fast or seems like hard work. And if you ever see your cat panting with their mouth open, that is almost always an emergency. The most severe and honestly the most frightening sign is when a cat suddenly can't use its back legs. This is caused by a blood clot that gets stuck in the artery supplying the hind limbs. Okay, if you only remember one single thing from our chat today, please let it be this. The absolute best thing you can do at home is to monitor your cat's breathing rate while they are sound asleep. It's easy. You just count the number of breaths, that's 1 chest rise and fall, they take in a full minute. A healthy, sleeping cat should be under 35 breaths per minute, and honestly, even better if it's under 30. If you notice that number starting to creep up over time, that's an early warning sign, and it's time to call your veterinarian. So let's say you've noticed something, or maybe your vet heard something a little funny during a checkup. What's next? I know the whole diagnostic process can feel a bit intimidating, but it's really just a logical set of steps to get us some clear answers. It all starts with that physical exam. If we hear a murmur or an odd rhythm, that's our cue to investigate further. We'll likely run some blood tests to rule out other issues and to check a heart biomarker called NT-proBNP, which tells us if the heart muscle is under strain. Chest x-rays can give us a bigger picture, showing if the heart looks enlarged or if there's fluid building up in the lungs. But the real definitive test, the gold standard, is the echocardiogram. It's an ultrasound of the heart that lets us actually see and measure those thickened walls. That's how we get a concrete diagnosis.
Getting a diagnosis like HCM can be really scary. I completely understand that, but it's so important to know that there is a hopeful path forward. While we can't cure HCM, for many, many cats, it's a condition we can manage, allowing them to have a really good quality of life. The whole focus of management really comes down to three things. We want to control any symptoms they might have, we want to improve how well the heart can relax and fill with blood, and, this is a big one, we want to prevent those terrible complications like blood clots and congestive heart failure. Every cat is different, so the treatment plan is always tailored specifically to them and what stage of the disease they're in. To figure out the right approach, we use a staging system. Think of it like a roadmap. In the very early stage, stage B1, we might just monitor the cat closely. But once the heart's upper chamber, the atrium, starts to get bigger, we hit stage B2. At this point, the risk of blood clots goes up, so we shift our focus to prevention. If a cat starts showing active symptoms like fluid in their lungs, that's stage C, and our goal is to treat those symptoms and improve their quality of life. Stage D is for very advanced cases, where our main goal is simply to keep them comfortable. And we have a pretty good toolbox of medications to manage these stages. We use drugs like clopidogrel specifically to help prevent those dangerous blood clots. If a cat is in heart failure with fluid in their lungs, we'll use diuretics like furosemide to help get rid of it. We might use beta blockers to slow the heart down a bit, giving it more time to fill with blood. There are other meds too. The main thing is that your vet will put together a specific plan that's just right for your cat. So, after all of this, what's the single most important message? It's that the partnership between you, the observant, caring owner, and your veterinary team is absolutely everything. Catching this disease early, keeping a close eye on it, and managing it with the right plan, that is the key to helping your cat live a comfortable, happy life, even with an HCM diagnosis. Thank you so much for your time today, and please remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.